try to keep your comments pointed towards the matter. There is no restriction, it's freedom of speech.
All right.
Yeah.
On that. But please keep it, if somebody's saying the same thing, if someone wants to be a spokesperson, that's okay as well, for the particular group. This is how we testimony from other applications as well. So we just try to stay on topic. If someone agrees with someone else, you can say that as well, or repeat it. So please, I'll just say, please state your name for the record.
Madam Chair, I just wanted to ask if there is a time constraint with respect to the board's meeting, and I know that we do have some other matters too.
We do, and I should probably mention that too, that in speaking, if you could limit your testimony to under 5 minutes or less to give other people opportunity. I know we had other hearings, but it was not really much for public comment, but we want to make sure we can get your public comment. And so if you can, that's why I just mentioned, if you can just, if speaking to the point, we can get everyone's point in as well. Okay?
I would like to make a statement in support of the petition requiring a special permit.
Please state your name for the record.
My name is Mark Rollo. I'm a resident of Fitchburg, and I have a medical practice in Fitchburg. And I did want to speak in support of the zoning petition requiring a special permit for medical office use in the downtown business area and neighboring district. As Madam Chair mentioned, it is the right and the duty of the city government to use zoning powers to promote the general welfare of the residents of the city. For example, if a city wishes to ban strip clubs or pornography shops from its business district, it would be within its right to do so. Such establishments are harmful to businesses and harmful to children who would have easy access to such facilities. The point I want to make is that medical facilities have the potential of being much more harmful than so-called adult entertainment. I would like to focus on how certain medical facilities can be harmful to children and thus should be under increased scrutiny in the downtown area, where minors, middle school children, would have easy access to such facilities. Some medical facilities routinely treat minors without parental consent. Such facilities are, in my opinion, destructive to families because it undermines parental authority. As a physician, I can tell you that if a 17-year-old came into my office with a strep throat, I could not give her penicillin without parental consent. I could not even see the patient without parental consent. By contrast, medical facilities whose sole purpose is to promote so-called reproductive rights are not required to obtain parental consent when it comes to life and death issues. Parents who are legally responsible for their children are therefore shut out of this very critical decision-making process. As a result, families, our city, and society in general are weakened. Some medical facilities give out potent medication which can cause heart attacks, stroke, liver tumors, and fatal blood clots. Such medication can be given without parental consent by certain medical facilities. I'm referring to hormonal contraception. If you are the parent of an adolescent daughter, and I imagine several people in this room have teenage daughters, do you want that child to have easy access to walk down Main Street from the middle school and walk into such an establishment? Would you want your daughter to go into this kind of a facility and get medication without parental consent? Suppose your daughter were to come to you and say, "Mom, Dad, I have chest pain," or "I have shortness of breath." Don't you want to be aware that she has taken a drug that could be responsible for these life-threatening symptoms? What's more, kids who take birth control pills are highly likely to take them improperly or discontinue them altogether. In fact, half of all abortions are performed on those who are using some kind of birth control at the time that they get pregnant. Some medical facilities have been known to cover up statutory rape. For example, the facility that plans to move into, the medical facility that plans to occupy 391 Main Street, that parent organization has been reported to have covered up a minor girl's sexual partner older than 21. A medical facility by law needs to report that to law enforcement for what it is, statutory rape. Some medical facilities provide so-called health education, which is being proposed at that site and may be proposed at other sites, to seek to promote their philosophy within the school systems under the guise of comprehensive sex education. This is the type of information that's going to be given there, so-called comprehensive sex education. The American College of Pediatricians recently released a statement strongly endorsing abstinence until marriage sex education and adoption by all school systems in lieu of comprehensive sex education. I would like to read a brief excerpt from the statement from the American College of Pediatricians. And the excerpt is, almost 40 years of emphasis on safer sex with values-neutral sex education, condoms, contraception, has clearly failed our young people. According to a 2004 Zogby poll, 90% of adults and teens agree with the American College of Pediatricians' position that teens should be given a strong abstinence message. Programs that teach sexual abstinence until marriage are much more than simply delaying sexual activity. They assist adolescents in establishing positive character traits, formulating long-term goals, and developing emotionally healthy relationships. These programs increase the likelihood of strong marriages and families, the single most essential resource for the strength of the survival of our city, of our state, of our nation. Anybody who's interested in reading the full statement from the American College of Pediatricians can get it on AmericanCollegeOfPediatricians.org. So, I refer to this document because this so-called comprehensive sex education is the type of health information which our kids will be exposed to without parental involvement. Should a medical facility like Planned Parenthood open on Main Street, rather than protecting kids, the Planned Parenthood philosophy is like throwing gasoline on a fire. As the American College of Pediatricians statement says, and I quote again, almost 40 years of emphasis on safer sex with value-neutral sex education, condoms, and contraception has clearly failed our young people. The fact is that increasingly available contraception has been associated with more sexual activity, more sexually transmitted disease, more out-of-wedlock births, and more abortion. Is this the kind of facility we want within easy access of our kids on Main Street, where 12 and 13 and 14-year-olds can walk in there and get on powerful contraception medications that can cause severe side effects? So, in conclusion, I would urge the planning board to support this petition so as to enable the city government to promote the welfare of our children by zoning practices which prevent easy access of our children to potential harmful medical facilities. And I might add that despite what Solicitor Ciota said about a permit being taken out before this action, I want to remind everybody that this was brought up in February, and it was inappropriately tabled by the City Council. So that is going to be contested. That's all I have to say.